Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Magnetic Resonance Imaging Scan, MRI. Introduction. An MRI, or magnetic resonance imaging scan, is a test that provides clear pictures of the structures inside the body. Healthcare providers may recommend MRIs to help in diagnosing various diseases, such as brain tumors or torn ligaments. If your healthcare provider recommends an MRI, the decision whether or not to have this scan is also yours. This program will help you understand the benefits and risks of this procedure. Test. A magnetic resonance imaging scan, known as an MRI scan or just MRI, does not use X-rays. Before the test, you will be asked to change into a gown and keep your belongings out of the MRI room. This will protect your watch, beepers, credit cards, and other magnetic-sensitive devices from the effects of the MRI machine. You will be placed inside a magnet. Some of the magnets used for MRIs are like narrow tunnels, and others are more open. While inside the magnet, you will hear loud noises. The combination of the magnetic field and different radio frequencies allows a specialized computer to generate excellent pictures of the inside of the body. The test takes a long time, sometimes as long as 1 to 1.5 hours. Even though it takes so long, it is important to lie still during the test to get clear pictures. MRI technologists are sitting in the next room and are able to see you through a glass. They are able to hear you at all times as well as talk to you. If you have any questions, be sure to ask them. They will be more than glad to help you. In case you are claustrophobic or afraid of small spaces, the radiologist may be able to give you some medication to help you tolerate the small space. Make sure to tell the technologist if you have this problem before the test. Some patients need a dye given through the vein to help visualize structures better inside the body. This dye is relatively safe, but it may cause a potentially fatal kidney disease known as nephrogenic systemic fibrosis, or NSF, in patients who already have kidney problems. This is why it is important to check the patient's kidney function before administering the dye. This is usually done with a blood test. The MRI on the left is done without the dye. You can see the brain but cannot recognize the tumor. After absorbing the dye, the tumor becomes much more visible, as seen on the right. This is an MRI of a normal brain. Risks and complications. MRI scans are safe. Because MRI technology is relatively recent, the long-term effects are not known. There are no reasons to suspect any harmful effect. Because of these possible long-term effects, pregnant women should avoid MRI and the dye except when the benefits clearly outweigh the potential risk to the unborn child. Because of the large magnet, many patients with cardiac pacemakers or artificial cardiac valves are not allowed near the machine. Some newer devices may be compatible with certain types of MRIs. Make sure to ask your healthcare provider if there are types of MRIs that are safe to get with your device. Patients with cerebral aneurysm clips should not have an MRI unless the patient has proof that the aneurysm clip is compatible with magnets. If you suspect you may have metal fragments anywhere in your body, let the technologists know. They can take X-rays of these areas to determine if it is okay to proceed with the MRI. The patients at highest risk for metal fragments are welders and people injured by shrapnel or bullets. Patients with metallic fragments in or near the eyes or blood vessels should not have an MRI. Patients with epidural electrodes and with cochlear implants should check with their healthcare provider who implanted the devices about whether they can undergo an MRI. Patients who have had a stent placed within 6 weeks of the MRI should check with their healthcare provider before having an MRI. Other implanted metallic material, such as a hip replacement or a knee replacement, may not be a problem. It is your responsibility to tell your healthcare provider, your radiologist, and your technologists about any possible implants or metal fragments. It is important. This information can help avoid potentially lethal complications. Because medical technology is continuously improving, biomedical companies are manufacturing more MRI-compatible implants. It is important to ask the healthcare provider who is implanting any medical device in your body whether the implant is MRI safe and compatible. It would be beneficial to have a document from the implant company that explicitly states whether or not the implant is MRI safe and compatible.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A magnetic resonance imaging scan can be helpful in detecting many kinds of problems in the body. To get the clearest picture, you should lie still. Because an MRI uses a large magnet instead of X-rays, it is safer than other technologies for looking inside the body. But because of the magnet, some people who have metal of some kind implanted in their bodies should inform their healthcare providers before the scan. MRIs are safe for selected patients. Risks and complications are rare. Knowing about them will help you detect them early if they happen. Thank you for using Explain.